This talk is about what is considered an adequate trial for a psychotropic medication. When developing a treatment plan, it is important to know what medications the patient has previously tried, including how effective it was, how well it was tolerated in terms of side effects, the longest duration that was tried, and the highest dose that was tried. An adequate trial refers to taking a med consistently as prescribed for an adequate duration and at an adequate dose. It is important to determine whether an adequate trial of a med has been completed, because it will help you decide which meds should be avoided and which to try or even retry. In clinical practice, very often patients will tell you that they have tried a particular med and it was not effective for them. However, it may be that they did not have an adequate trial. If this is the case, then you may inadvertently avoid using a med that could potentially help the patient. Furthermore, most often we start treatment with meds that are most easily tolerated. If you prematurely decide that a particular well-tolerated med was not effective, then you may end up subjecting the patient to unnecessarily uncomfortable or even harmful meds further along in your treatment algorithm. Now that we've discussed the importance of understanding adequate trials, next, let's go into more detail about what constitutes an adequate trial. Again, an adequate trial refers to taking a med consistently as prescribed for an adequate duration and at an adequate dose. An adequate duration is the duration needed to achieve the maximum efficacy of the particular med. For example, in treatment studies of major depressive disorder, although some patients experience initial improvement in depression symptoms within 1 to 2 weeks of starting an antidepressant, it takes 4 to 6 weeks to experience the maximum improvement in depression from a particular dose of antidepressant. An adequate dose is the highest dose of the med that is approved by the FDA for a particular treatment indication, or the highest dose that the patient is able to tolerate based on side effects, also known as the maximum tolerated dose. A medication trial is considered to be a failed trial if the med is ineffective for the intended treatment goal once the med has been tried for an adequate duration and at an adequate dose. A failed trial could also mean that the med is intolerable to the patient due to side effects or due to safety reasons, even if the med has not been tried for an adequate duration or at an adequate dose. If either of these conditions are true, then, again, this should be considered a failed trial, and the med should generally not be tried again in the future. One important thing to note is that how an adequate trial is defined depends both on the med being used and the indication for which it is being used. For example, an adequate dose of fluoxetine for treatment of major depressive disorder is different from an adequate dose for obsessive-compulsive disorder. Next, I'll give an example of what would be considered an adequate trial of the antidepressant escitalopram for treatment of major depressive disorder. An adequate trial of this med for this indication would mean treating as intended for at least 4 to 6 weeks with the FDA maximum dose of 20 milligrams. If the med was tried for a shorter duration than this, or at a lower dose, then it would not be considered an adequate trial. However, if the patient was unable to tolerate 20 milligrams due to side effects, but they were able to tolerate 15 milligrams, then an adequate trial could also mean taking 15 milligrams for at least 4 to 6 weeks, and then 15 milligrams would be considered the maximum tolerated dose. For completeness' sake, a related concept is the minimum effective dose, which is the lowest dose of medication necessary to achieve the intended therapeutic effect or goal. For example, if 5 milligrams of escitalopram was not enough to achieve remission of depression, but 10 milligrams achieved this effect, then 10 milligrams would be considered the minimum effective dose. In general, you should avoid using higher doses than the minimum effective dose to limit adverse effects. That's the end of this talk. I hope this helps in understanding treatment decisions. Thank you.